Good morning. This is Michelle from the Colorado Health Institute. We're letting people have a few minutes to grab their chairs and coffee and join us this morning, but we'll get started in just a few minutes. Good morning. This is Michelle from the Colorado Health Institute. We'll just give people a couple more minutes here and then get started. Good morning. All right. All right. Well, before we get started, perhaps I can share with you just a couple of housekeeping items. First, this presentation will be best if you switch to speaker view in the upper right-hand corner of your screen. Also, we'll have time during the presentation for questions, so get ready to ask them. You can do so by sharing your questions in the Q&A box at the bottom of your screen so that we can track questions that we've answered. So that just helps us make sure that we get to everything. We'll be using menti.com in the presentation to collect and share your feedback. And so when you get a chance, open a new browser on your computer or tab on your phone and go to menti.com so you'll be ready to enter the code to participate. And with that, I think we'll get started. We have a healthy group of people here today and our healthy number, and we'll kick things off. I'm happy to do that. I am, for those of you who don't know me, Michelle Leek with the Colorado Health Institute. And I want to welcome you all to a special Eggheads presentation that features my longtime colleague, Sarah Schmidt, as well as our partners, longtime partners at the Office of eHealth Innovation. Now, this is our first Eggheads of 2022, and it's an opportunity for us to share a project that we're really excited about. CHI believes that good health policy leads to a healthier Colorado. Every day, we strive to bring research, insight, and expertise to leaders across the state, including all of you, because informed decisions lead to better health for all. Eggheads is a way of making sure that all of us are included in that conversation and community engagement. One of my resolutions for CHI in 2022 is to focus on our impact. It's easy to get bogged down in day-to-day conversations about the pandemic and Omicron and everything else. Sometimes we forget to look at the big picture. We overlook the impact of our work. So I've committed to my team that I want to start out every meeting, including this one, by focusing on our impact. And since the team here has given me the mic for just a few minutes, I'm going to ask the same of you. Can you take a minute in the chat to tell us one area that you seek to have impact in 2022? I'm going to watch the chat for just a minute here and see what people put in. I'd like to call out a few people that I know, because I know some of you might be a little reluctant early in the morning to do this. So Chet and Jeffrey, Megan and Rebecca, I'm looking for your answers right here. All right, Sharon's going to lower some drug costs. Brent is going to integrate oral health care into the medical system. We're going to improve social connections for health and well-being. Anyone else? All right, 3 more new messages. Megan, thank you for participating. She's going to build a coalition to increase stakeholder capacity. Jeffrey, thank you. Improving health systems and information and accessibility. I can tell from all of these impact resolutions that you have arrived at the right place to spend the next hour with us today. So thank you so much for doing that. There's a lot of big goals and there's tremendous opportunity in 2022, and we're eager to share some of that work with you. Another big opportunity in this year that's related to all of these comments is implementing Colorado's own health information technology roadmap, which is what we're here to talk about today. And in order to do that, I'm going to turn things over to Stephanie Puglisi. Did I get that right, Stephanie? All right, Stephanie Puglisi, Colorado State Health IT Coordinator and Deputy Director at the Office of eHealth Innovation. She's also a friend and trusted partner of CHI's. Stephanie, good morning, and thanks so much.
Good morning, Michelle, and thank you. Impressive guess on the last name, too. We didn't prepare you for that, so surprise. Good morning, everyone. It's great to be with you here today. And if we can go to the next slide, Sarah. Thank you. So for a background for any of our friends here who may not be as intimately familiar with the Office of eHealth Innovation, or OHI, we are the state designated entity for all health IT strategy, policy, and funding coordination. We're located in the Office of the Lieutenant Governor and work closely with the State Medicaid Agency, or HCPF, Healthcare Policy and Financing, as our fiscal agent. And that situation and location for us is really meant to ensure that we have the ability to work across the state and not be centered in an agency, but also work with the state and federal Medicaid funding to maximize our opportunities to match state and federal funds. The eHealth Commission, which Michelle is a former commissioner, advises OHI in the state and steers strategic roadmap efforts. And our roadmap is developed every 3 to 5 years with broad stakeholder input. And we have recently refreshed the strategy to focus on health equity, affordability, and access in partnership with CHI. Our primary goal is to advance the Polis Primavera administration's bold health priorities through Colorado's health IT roadmap initiatives and create a Colorado for all. And Sarah, I think we're ready. Thank you. So one goal of this engagement process for the roadmap refresh was to hear about the work already underway and find areas of alignment and collaboration. OHI is a small and mighty team, and so we recognize that although we are that state designated entity to lead the strategy, we can't do it by ourselves, and we shouldn't. And this stakeholder engagement process ranged across the state, and incorporated state efforts such as the Behavioral Health Task Force and the Behavioral Health Administration, as well as Medicaid's alternative payment efforts, and in partnership with those of you who might be at the local effort to support the improved consent processes, health IT adoption, and cybersecurity. We really wanted to understand how the roadmap recommendations could support and enhance these activities. And we hope that you see that in the actual document and the recommendations. Ultimately, this really goes beyond the immediate scope of health information technology. And we want to ensure that our partners in public health, environmental health, health insurance, public safety, community-based organizations, and so many others represented on this call and beyond are included in this work. And again, really working to make this a statewide effort. And Sarah, on to you.
Yeah, thanks, Stephanie, and good morning, everybody. Sarah Schmidt with the Colorado Health Institute. Thanks for joining today. Just to give a sense of some of the work that happened really over the summer and into the early fall of 2021, I want to really call out the eHealth Commission, and in particular, a small planning group that really was guiding this process along the way. eHealth commissioners, including KP Apala, Rachel Dixon, Art Davidson, Mona Bassett, Kevin Stansberry, and Michael Archuleta. They met regularly and were really, again, guiding the work that happened, in addition to the monthly eHealth Commission meetings, where we were talking about progress, feedback, making refinements to the roadmap draft along the way, which also included opportunity for public comment. We held more than 50 stakeholder meetings. Those are a lot of fun. Most of them were virtual, but we did have 2 community meetings. We were able to travel out to Haxton and also travel down south to Trinidad and have 2 in-person meetings with community partners during that very brief window over the summer when we could have in-person meetings and feel okay about doing that. It was good to get out of Denver. We also hosted 2 virtual listening sessions, including one that had live translation with Spanish for Spanish language, as well as an online survey that was posted in both English and Spanish. And then we also put the final draft of the roadmap up for public comment for maybe about a week or 10 days. Again, really with the hope and the goal of trying to connect with as many Coloradans as possible and hear from them. Hear from all of you and make sure that that was reflected within the roadmap. And again, hopefully you'll hear some of those consistent themes in some of the goals and recommendations that we're going to be talking about next.
The 2021 Colorado Health IT Roadmap aims to put Coloradans and their health first. And its goals and recommendations support Governor Polis and Lieutenant Governor Primavera's vision for all Coloradans, that they can access needed care when and how they need it, they can afford the care they need, and all have equitable opportunities and resources to be healthy. And the ultimate impact, this strategy and we are aiming to achieve access, affordability, and equity. Quality healthcare should be available and accessible to all Coloradans, regardless of their location throughout the state, rural, urban, everything in between. Emerging from the COVID-19 pandemic, this work is vital to support healthcare workers as well. And please know that both sides of that were really incorporated in thinking through this roadmap. Yes. At long last, for those of you who haven't seen these yet, and those who have and hopefully are excited about them, these are the 3 overarching goals of the Health IT Roadmap. And I'll read them to you really briefly, just in case. So the first one is Coloradans, providers, payers, community partners, state, local, and tribal agencies share data and have equitable access to needed health and social information. The second is Coloradans access high quality, in-person, virtual, and remote health services that are coordinated through information and technology systems. And the third is that Colorado improves health equity through inclusive and innovative use of trusted health IT and digital health solutions. And these are intentionally very broad and also very bold. And we've given ourselves the timeline of this strategy to be achieved, and are working on defining what that achievement is by 2024. And so this is moving quickly already, as we're already almost 1 month into 2022. And that's again why webinars like this and engagement with all of you are so vital as we plan to implement our strategies to achieve these goals. And as I mentioned, we're currently working to define what success looks like for each of these goals. And that is achievable in the next 2 years. And so from there, we'll define metrics and milestones to measure progress toward these goals. And, it's so exciting to have this strategy, and we're very proud of it and grateful for all of the engagement we've had. And we want to run quickly and start achieving these goals, but we also are working to really do it right and think through what do we have now and how can we measure our progress incrementally so that we achieve meaningful success in 2024.
So the 2021 roadmap includes a set of recommendations for policies, for funding opportunities, and for services that are really intended to achieve those goals. And before I talk about a couple of examples, I want to acknowledge my CHI colleague, Paul Preskin, who was very instrumental in really thinking through these recommendations and also bringing his technical expertise to really refining them as well. We also really leaned on a lot of partners, including the eHealth Commission, to really kick the tires on these recommendations, so to speak, and really understand, refine them, and make sure that we could stitch these recommendations, each one to a Colorado opportunity. So is there something that's already happening within Colorado's ecosystem that Stephanie will talk about next that can really be aligned with or coordinated or connected to the work that will be happening over the next, 3 years. We're already in 2022. So just to give a couple of examples, on the policy front, we certainly heard from a lot of people calling for a need to have policies that really adopt shared data sharing agreements and processes around consent, and both consent as well as consent revocation. So when is consent given, and then when can it be taken away? We know that there's a lot of work underway to really improve sharing information, and that includes health-specific information, whether that be medical, oral health, or behavioral health, but also sharing social information as we are really trying to address whole person care. And having those shared data sharing and consent processes really dialed in is really helpful in terms of thinking about care coordination, but it also provides Coloradans with some clarity and understanding around when, how, and with whom their data are or are not being shared. And very grateful to a lot of individuals across the state who really spoke through the roadmap process around consent processes and what worked for them in terms of being able to give consent and understand what that meant, and then also really talking about needing clear standards for when they can pull that back. So that's one example of a policy. On the funding side, the roadmap calls for state agencies to really be thoughtful about braiding their resources. And in particular, when there are activities or solutions that are really supporting shared priorities across those state agencies. So how do we think about, as a state, being able to invest in one solution or perhaps in one technology when we know that that will meet multiple use cases across our state agencies? The roadmap was also very intentional about acknowledging the need for funding and incentives for both providers, but also our community partners and community-based organizations for adopting digital health solutions or digital solutions. That might mean electronic medical records, maybe that means telehealth technology and tools that might be needed to provide remote and virtual services. And a layer to that recommendation is really thinking about those providers that were not eligible for previously available federal incentive payments. So who has not necessarily been able to tap into those supports previously, and also those providers and community agencies that are in rural areas and serving and working with underserved communities. So those are some funding examples. And then lastly, the service recommendations in the roadmap have to have technology service recommendations, call for establishing a set of core services that can be shared across agencies and providers and Coloradans to really bring some efficiency and coherence to what is really a fairly decentralized system in Colorado when we think about our overall HIT ecosystem. So what we mean by core services are things like a provider directory or a provider index. And we know, for example, that our colleagues at the Colorado Department of Public Health and Environment are already doing a lot of work to really pull something like this together that could be used by multiple partners. Another example could be that consent management system that aligns with the policy recommendation. Another one might be thinking about identity and identity management. And how do we make sure that agencies and providers are referring to Sarah Schmidt the same way across all of the services and systems that I might be accessing and using to, again, helping ensure that alignment and efficiency and coordination. So that's one example. The roadmap also calls for exploring what a scalable data sharing platform might look like in the state. And think of it as kind of a single entry point or an on-ramp where providers, agencies, Coloradans could really be able to access, share, and receive needed data, but also use those core services, for example. Possibly other things could really be accessed through that single entry point. This doesn't mean that data becomes centralized in one place. It doesn't mean that Colorado now only has one system. It means, how do we create an easier way to access all of those things that are available? So how do we think about a front door or a single front door or a single on-ramp to be able to make it a little easier and more efficient, to be able to use all of the tools and technologies that are available in Colorado? So that was like lightning speed summary of the recommendations. I hope that y'all have a chance to take a look at the actual roadmap and kind of dig into some of the details on all of them. Stephanie.
Sarah, excellent lightning round there.
Thank you.
And, you know, the 2021 roadmap, as we've said through the past 20 minutes, has called for an IT ecosystem that allows all partners to share data and have secure, equitable access to needed health and social information. And data sharing can be scary, and especially in, you know, personal health information, but we really intend this to be in a legal and safe way. So I want to give that caveat. We recognize that not all data can or should be shared, and really want to call out that by sharing data, we mean within the bounds that it is allowed to be shared. And this graphic is a guide, or our trail map. We do live in Colorado, for expanding patient access to information, as well as other uses, including value-based programs, care coordination, population health, and more. And again, that really brings in, it's more than health IT, and health IT encompasses all of these different, you know, efforts and organizations and individuals such as yourselves. And the roadmap's values really guide these efforts to advance access, affordability, and equity for all. And you can see the initiatives within this ecosystem that can be supported by the roadmap. And I've said them before, but I'll say it again. Public health, virtual and remote care, care coordination, population health, environmental health, broadband even. And let's see. So in that vein, in a more granular level, we've canceled all work groups that OHI leads in January to give our staff and partners time to develop recommendations for implementing the 2021 roadmap. And these cancellations may continue in February unless there are urgent items in individual work groups to discuss. And so I want to call that out because I know many of you are involved probably in multiple work groups. And please know that that's not our way of saying, leave us alone, we're busy. It's saying, give us some time to bring something meaningful to you to help us engage in a productive way. And instead of kind of having those conversations and spinning and talking about those larger goals without those metrics and milestones to react to and to help us figure out. And in that vein too, before restarting our current work groups or convening new groups, we really want to be intentional about the use of everyone's time and resources. And in that way, we're considering other state and community groups that we can support toward accomplishing the roadmap goals rather than convening duplicate groups. And that's exactly where we need your help. And you know, the time of listening to just Sarah and I talk is coming to an end, and we really want to hear from you about what are those community efforts already happening. What would you or your group want to lead that OHI and the state can support instead of always taking the reins? And so I think we're ready for questions.
Yeah, I think so. Just before we dive into questions, we're going to spend a little time just with questions, and then we're going to move to some interactive Mentee activities, as Michelle had mentioned. So you don't need your phone for Mentee quite yet, but we're going to get to that shortly. But want to make sure that we have a pause for any questions that folks might have.
We do have one question coming in from Lynn Jones. And Lynn, do you want to ask this question? Can you, and I believe you can unmute yourself. I'm not hearing from Lynn, not quite sure, but I will go ahead. Lynn asked, was there discussion around using the data to determine regions/communities' workforce needs with the potential to de-identify worker personal information, but take into account their training levels, certifications, et cetera? Data like this would be helpful to push the workforce effort forward, as has been recognized by other entities working on these issues.
Great question and topic. Coming in strong at 8:25. And, you know, Lynn, I think that's exactly the information we need to hear. So we've heard, you know, for the past 25 months about workforce shortages, specifically in the health community, but I think these are the ideas that we would love to hear. Sarah, would you add anything?
Yeah, and I might invite if Paul wants to jump in here too. I think, so we heard a lot about workforce and a lot about needing better data to be able to understand and be able to have access to some of that information. And that was one of the things that really informed some of those core services. And in particular, how do we think about a provider directory or provider index? You know, not necessarily needing everyone's information per se, but a mechanism for being able to sort of have some standardization and organization to then use those data in different ways. And that was one idea there behind the provider directory or provider index. Paul, is there any, do you want to put a finer point on that core service or anything else you'd like to share?
Yeah, no, I think you're right. I think the provider directory is probably the closest that we came to addressing workforce in the health IT roadmap. And, you know, it originally wasn't in there, and then we had quite a good discussion about needing to really be all inclusive of those providers. And when we say providers, we're not just meaning physicians, but all manner of those that are providing health, healthcare services in the state. So I think that's where we addressed it most directly.
Thank you both. Getting a couple questions coming in on the chat as well. Question from Sharon: what about disease registry, for example, cancer?
I guess I would want to know a little bit more about what you're asking, Sharon, unless Sarah, you look like you might know.
Oh, no, I don't want to assume.
No, you don't know. Are you, Sharon, I guess, as far as having a disease registry, I'm not aware of a centralized one. I know our Colorado Public Health and Environment manages a few of them, but that's a great point as well.
All right, we've also got a question.
Oh, Christy, I might just jump in. I think that's also perhaps an example where, again, having some, I don't mean to keep going back to core services, but having some shared tools across different agencies and providers is, again, there's ways to explore how to perhaps implement some of those core services within something, for example, like a registry, to be able to share information in a more seamless way. And I think we also, through this idea of a scalable data platform or a kind of a single on-ramp, we did hear from many providers who talked about, there's a lot of stuff they need in order to be able to care for their patients and provide whole person care. And they're going to different places and trying to find different things. And is there a way that can just be a little easier to kind of go in one place to find it? And registries were one of those things that providers identified as being very important for providing care and sometimes being hard to kind of track on in multiple ways. So hopefully that's some helpful context.
All right, we've got a question here from Edward Daniels. Edward notes, we have multiple health information exchanges in Colorado and also multiple very large hospital networks. How would a single on-ramp work given today's state of multiple access points?
So I think Sarah kind of started to answer that question, but that's a great question too, Edward. And I think, you know, it's starting with consolidating. You know, one thing we heard from providers is we have to provide the same information to multiple state agencies, and that takes a lot of our staff time and doesn't feel, you know, necessarily not worthwhile. I don't want to put that out there, but honestly, it's a waste of time. And so thinking through things like that of how can we provide one front door for folks to provide that information and distribute as needed. And then as far as the hospital networks and HIEs, you know, I think that's something that we continue to work with those organizations with to increase interoperability and ensure that, again, it's less manual and more automated. So I'll start there, and Sarah and Paul, please feel free.
The roadmap has some additional details on kind of the thinking behind what this might look like. And again, a little plug for everybody to read it. Hopefully it's not too long. But one of the things was really bringing some folks together to really better understand the technical architecture that is in place in Colorado, and as you trying to understand all those different multiple entry points and what are some ways to kind of thoughtfully be able to stitch that together. So I know that there are some ideas about how to get that conversation started.
All right, we've got a question coming in from David Aylward. David, I believe that I have given you mic access. Do you want to ask your question? And it looks like maybe I am having some technical issues on that side of the house. So I'll just tell you, David says, traditionally the focus is on connecting providers. You are broadening providers to include CBOs, social agencies, et cetera, which is great. But most health IT today is based on the need to record actions and bill for them. How about user-based design and specifically designing around the needs of the people we are serving, walking through use cases with the eyes of families we are serving?
And I also see a couple other, I see Phyllis's comment in the chat a little further down. Stephanie, do you want to talk about the Innovation Center recommendation, which I didn't talk about in our presentation, but I think gets at some of these pieces.
Yeah, and I actually would love to start too with the behavioral health efforts starting in the state. And I know that's a little maybe left of center from David, your specific question, but I do think it's relevant in that, you know, last year, there was legislation passed to stand up the Behavioral Health Administration as a single, you know, again, I use the term front door for behavioral health access in the state. And we're working closely with that team as well as Medicaid and Public Health and Environment to ensure that this can be a statewide solution. And one of those work streams and work groups is focused on user design and user-centered design for exactly that reason, David, and you're spot on and really appreciate the comment. And you know, sometimes government is a little slow to catch up to the technology world. So that's where OHI kind of tries to balance those things. But I think that we're learning a lot from that effort and do want to expand that to the rest of our design. And then Sarah mentioned the recommendation for a Colorado Innovation Resource Center. And you know, I've had some interesting conversations, and it's funny when you work to develop this and you do all the stakeholding and conversations, and then you get so close to it that someone asks a question and you think, well, no, that's not what it is. And you realize that if they weren't there, they wouldn't know that. And so I had someone ask about, well, would the Innovation Resource Center be a physical center? And I thought, well, that seems a little backwards since we're trying to promote virtual health in my mind. But honestly, we didn't clarify that. And so, you know, I share that anecdote to say that, again, these recommendations are pretty broad, and the intent is to work together to figure out what is the best solution. And so all that to say long-windedly that the resource center is intended to be that that hub of best practices and guidance and coaching for virtual care.
All right, I am going to surface another question / comment from David. He says, love the focus on braiding funding to support shared services. Can you apply that to care management versus each agency / profession having its own silo care management system?
I'm going to be honest, and I don't know that I fully understand the question.
So David, for us to be able to unmute you, my colleague needs to be able to find you. Can I ask you to raise your hand? All right, if you want, oh, there we go. David's raised his hand. We're gonna unmute him.
I think there's a wonderful opportunity to do just what you described that's going on right now with multiple agencies who have budget to do care management. And it's all the same people we're talking about. So I was just wondering how, if you agree and see that as an opportunity to do just what you're talking about, of braiding together rather than using individual budgets to reinforce silos.
Absolutely.
And by the way, I
Absolutely.
think this is wonderful and refreshing and really exciting. So go ahead.
Thanks, David. Always appreciate your thoughtful questions and engagement. And I completely agree. I think, one thing at the state that we're working through is we have these umbrella terms that we all use, but they might mean different things to different people. So care coordination, care management, how do they differ? How are they the same? And so thinking through that, but absolutely want to use that approach wherever we can in order to maximize our resources, time, efforts, and really, again, follow the values of the roadmap and build things that are sustainable and reusable.
Anything else, Christy? Should we?
One last comment from Lynn Jones. It's the only other one I'm seeing. She notes Colorado Hospital Association has convened a group around workforce across the healthcare worker spectrum and is working on proposing legislation to address data like this. Was one of the key needs as described by the members of that group, parentheses, paraprofessional, allied health, certified and credentialed, et cetera. Maybe there's some cross alignment with these efforts down the road as far as rating of resources. And Lynn,
Yes.
if you want to comment further, please do raise your hand. And Kimberly dropped in the chat. This goes back to the disease registry question that we got a little bit earlier, that there is a registry and specifically cancer registry work going on in a national standards effort. And she did drop the link to that work there. So that's something that we will take a look at and encourage others to as well.
Yeah, so Lynn Jones, and I also am working with David Aylward on a statewide project, and a spinoff of that was getting involved in the Colorado Hospital Association's work to align workforce with the needs of communities and also try to garner some funding to help address the dearth of providers and healthcare workers, particularly in rural and underserved communities, and is working with Representative Mullica and Lontine to take that to the next step. So just wanted this group to be aware of that if they're not, and also that David's project, the community collaborative response, where we're looking at metrics that are driven by social determinants and thriving asset-driven stuff versus kind of how the current medical EHR system is set up. So thank you.
That's great, Lynn. Thank you for sharing that. And, we have some efforts at the state that our team kind of hasn't had a lot of capacity to be involved in regarding workforce, but I think this is a really great issue that you're bringing up, and one that we absolutely will envelop into our priorities going forward.
And I'm not seeing any more questions either in the chat or the Q&A, Sarah, so you are free to go to Menti.
Okay, everybody come back. If you put your earbuds in and walked to the coffee pot, please come back. We want to just walk through a couple questions and hear maybe from some additional folks in addition to people who have already chimed in. And we're going to use Menti as a way to do that. So as Michelle mentioned, if you could either open up a new browser window or pick your phone up and navigate over to www.menti.com. While you're doing that, two things to share. Everybody who responds in through Menti is an anonymous response. We aren't able to connect answers to people who type them in. So if you are typing in something and you want to be connected to that, please put your name in there. And that lets the OHI team know who you are and how to follow up. Also want to just flag that if you cannot open up Menti, you can also submit your answers to the questions in the chat function. So again, www.menti.com. Okay. The first question is kind of getting to that success. And so if you go ahead and enter the code, there's a code in the chat, 58814007. What does success look like for these 3 roadmap goals? So we're thinking about access to information, digital health equity, and coordinated care. You should be able to type in a sentence or two on what that means to you and what does success look like for any of these 3, for all of these 3. Would love if someone wants to kind of, sometimes it takes a minute for, the internet of the world to catch up, but looks like people are maybe on community efforts. So let's go there. Flexible, name of the game. So let's start there. What are some community efforts that are already underway to support those 3 roadmap goals? And thank you for everybody who is kind of putting stuff in there already. So maybe we'll answer on both. If you've got some examples, I do see we've got a couple good examples coming in here. I also think there's some folks who are responding to those goal pieces as well. So we'll give people a couple minutes to type some things in. Just type in some thoughts on success or community efforts that you'd like to flag. All right, and is there anything in the chat? Stephanie, do you want to chime in and maybe just respond to a couple things, or?
Sure. Yeah, these are great. And I see it, Renata in the chat, we seem to be stuck on the community efforts one. So you are in the right place for now, and we'll figure out how to get everyone to the definitions of success, or we'll just use this one. So we're seeing some really great initiatives in here. CCMCN, Farley Center, Colorado Health Association, CDPHE, and Veg Health. I'm not aware of that one. So if someone could maybe add a little bit more detail, or Sarah, if you are aware. Let's see, the Northern Colorado Health Alliance and Community Resource Network. That's great. The Social Health Information Exchange is showing up on here a few times, which is wonderful. HCPUF's Hospital Transformation Program, HTP.
I'm going to try to scroll down, and sometimes when I do that, I go to the next slide, so hang in there.
That's okay, I'm ready.
See? This is what happens. Give me just another minute. I'm going to pull them back up. Here we go. Is it coming back in? Stephanie, are you able to see?
We see a beautiful Colorado flower.
Yeah, okay. Well, maybe we seem to be having some, let's try that. No?
There's the flower again.
Okay.
In the comments, Lynn noted that perhaps you already surfaced this, that it was behavioral health, not veg health.
You know, vegetable health is important too, for all of our health. So I appreciate both comments. Thanks, Lynn. Yep, and Douglas has the same thoughts. If we all eat more vegetables, that might help our mental health.
Yeah.
I love it.
Couple things.
Quick group today. Let's see.
Yeah,
I'll go to
some things just
mentee.
to call out the State Oral Health Strategic Plan that is creating collective impact and creating some a roadmap on oral health programs, social health information exchange, working to build an oral health data resource center, the community crisis response efforts, the Colorado Health Observation Regional Data Service Initiative for Front Range counties. These are some examples that people have already been putting into the chat. Great. Why don't let me go ahead and maybe if people want to, if anyone wants to put anything else into the chat, Stephanie, if there's anything else coming up.
Sure, I'll keep an eye on it. And while we're still working on mentee, the other question that we wanted some input from this group on was, what would success look like for each of those goals? So if you read those three high-level goals, what would you know, if we accomplished this by 2024, what would that look like? And here we're really looking, you know, someone had put, and I'll paraphrase because I unfortunately don't have a photographic memory, but someone had put in the mentee slide that it's invisible and it's almost like people don't know it's there. And I think that is such a beautiful and well said you know, explanation of health IT. And it's really, you know, supporting a patient and a provider in their healthcare, and something that I know our office, as well as the Lieutenant Governor, really prioritizes, is taking the burden of knowing your entire health record off of a patient. And so that if you took a specific medication years ago, and you're at an ER or you're at another provider, that the burden is not on you to recall that specific prescription, and kind of course we're all our own advocates, but again, really making that automated and not so manual and burdensome on the patient. So any other thoughts of what success looks like? For example, one that we've circulated just in brainstorming on our team for that third goal about health equity is to think through, what if we developed an inventory of digital health services in Colorado, and potentially even the option nationwide if we're really ambitious, that are you know, promoting equity specifically, or are safe, or not safe, that's maybe a little too far, but are supportive of different communities, and you know, have that available widely. So they could be things, they could be, these definitions of success could be outcomes, they could be things, they could be, what does it look like, what does it feel like? So it's pretty open. And feel free to put that in the chat for now.
Stephanie, are you able to, do you see the next getting involved, next steps? Maybe I don't see anything more coming.
Sure. Should we move that way?
Yeah.
Oh, it is almost 9 already.
Right.
Great. Well, you know, and please feel free. I'll make sure to put my email in the chat, and you're welcome to reach out to me individually. And then please feel free to engage with us on our monthly commission meetings and other things. So, and that's the first bullet here. I'm getting ahead of myself. So we do hold monthly eHealth commission meetings, generally on the second Wednesday of each month. This month we did push it back a week. We had some conflicts, so ours was actually yesterday. And our website is always up to date with the latest meeting information, as well as other ways to get engaged. You can sign up for communications on our projects, funding, and collaboration opportunities, and we send out a regular newsletter there. And then we also have a form to submit a use case, idea, or collaboration opportunity, and that can be really helpful. I know everyone's got a lot of meetings all day, and sometimes it's difficult to find time to talk about things. So if you have an idea and want to share it, Natalie is putting all those links in the chat for us.
And I think this is.
Yep, and I think that's it. So that's our website, and like I said, it's always up to date with what we're up to and ways to engage. And please know that again, as we kind of, I call it groundhogging, as far as thinking through how we're going to operationalize this work, that we really appreciate all of your engagement and thoughts and ideas and really partnerships. And I'm seeing some really fantastic ideas and support in the chat. And so we can't thank you enough for your time and engagement this morning.
Christy or Deanna, are there any other questions or comments that we want to either read aloud or talk through in the chat before we wrap?
Just a couple of what success looks like have emerged. Kelly Sprong notes, when I think of a thriving Colorado, I imagine our systems honor what people bring to their own health, building supportive connections in a person's relationship and supporting them accordingly. And I'm also seeing a comment from Phyllis, specialty care e-consults funded by HCPF for Medicaid patients so that clinics that have not been included in UC Health's efforts can find specialty care support on their own. Those are the only two I'm noticing. I don't know if you had any comments or follow up on those.
And I think David had one that says, how about interoperability and other standards that must be met to get state money? Absolutely. I think all of these are incredible and spot on, sharing both priorities and ways to get there. So thank you all. Let's see, it looks like there's still one. Looks like Jeffrey says better specific outcomes for key disease states. David says let public see how their providers are doing and hold them accountable.
All right, it looks like the chat is winding down.
Well, I'll go ahead and put my David. David says create the metaverse and give the keys to Mark Zuckerberg.
That was a recommendation. We pulled it out.
So I just put my email in the chat. Please feel free to reach out. And again, thank you all so much for your engagement and also grace with our a little bit of pivoting this morning, keeping us on our toes. So thank you all and really appreciate you. Folks, feel free to keep adding ideas or feel free to drop. I think that's the extent of our presentation today. And again, thank you and hope you all have a great day.
Anything else from Team CHI on next steps with future presentations or?
Nope, we are all set. We are just about to close down. We're just trying to make sure we capture all of the chat before we close out.